Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Healthcare can feel like a maze sometimes. Frustrating delays, confusing steps, moments where you just think, there has to be a better way. What if there is a proven approach that could untangle that complexity in healthcare and put the focus back on care? Today, we're exploring lean. We'll see how this idea, which sounds like it's straight out of a factory, because it actually is, transforms the healthcare experience. When most people hear about lean, they think of assembly lines, cars, efficient factories. But the fascinating part is how this management philosophy has been adapted to streamline healthcare delivery. Its goal is clear: increase value for patients and cut out waste. And this is crucial: respect the people doing the work day in and day out. But first, let's rewind a bit. Where did lean management or lean thinking actually come from? Its roots are in Japanese manufacturing, specifically the Toyota production system. And a lot of this thinking was influenced by an American statistician, W. Edwards Deming. So the idea kind of traveled across the Pacific and back again. At its core, lean tries to use less to do more and pursues the perfect process. But it's not about hitting some impossible ideal of perfection. It's about fostering a culture and a mindset of continuous improvement. Little steps all the time, not a one-off project. Eliminating waste strips out anything that doesn't actually add value for the customer, who in healthcare are the patients we serve. And the respect for people part, it's the belief that frontline healthcare workers, nurses, doctors, techs, clerks, they're the experts on their own work. They're the ones best placed to spot problems and, importantly, figure out the best solutions. Here's an example. Say I hunt for supplies in my clinic to take care of my patient. From my perspective, I'm busy. I'm doing my job serving my patient's needs. I'm running around because I care. But through a lean lens, the time spent searching for supplies, that's actually waste. Wasted motion, wasted time, wasted effort, time that I could have spent directly with the patient. It makes you rethink what being busy actually means in a hospital or clinic. In today's episode of Mapping Healthcare, we visit Aravind Eye Care System in India. Arvind's origin story goes back about 50 years when ophthalmologist Dr. Govindappa Venkataswamy, also known as Dr. V, wanted to eliminate needless blindness among people who face poverty. With that mission in mind, he started an 11-bed hospital with 6 beds for patients who could not afford to pay for their care and 5 beds for patients who could pay. Today, the Aravind Eye Care System has grown into a large network of clinics, hospitals, production facilities, research labs, and education centers that have treated millions of people. And really key, about half of these people, those who otherwise would not be able to afford eye surgery, receive absolutely free care. The hospital was a small family-run affair to begin with. Dr. V's siblings contributed their savings to help build the venture, and the organization still has a large family presence. Our guest in today's episode of Mapping Healthcare, Dr. Aravind Srinivasan, is Dr. V's nephew. He is the Chief Medical Officer of the Aravind Eye Hospital in Chennai, India, and we talk about how Aravind Eye Care System incorporates lean management into every part of its work. The views expressed on the show are mine and those of my guests. So Aravind, welcome to Mapping Healthcare.
Thank you for having me, Ulfat.
I just wanted to share that I was reading and researching this issue around cataracts in India, and according to a recent paper in the Indian Journal of Ophthalmology, India has about 5 million people who live with blindness, mostly due to cataracts. I've seen varying numbers, but I just picked this one that I read in this fairly recent paper. And cataracts affect people in India usually in their 60s, That's a little bit earlier than we see them here in the United States. And I was reading that this is likely due to exposure to sunlight and smoke or nutritional deficiencies. So clearly, this is a problem of immense magnitude in India. But Arvind has tackled this magnificently, and the success of the Arvind Eye Care Systems business model depends on reducing costs and improving value through mapping healthcare flow and increasing scale and efficiencies, concepts that are integral to lean management. So, what are some of the operational processes that Arvind uses to do this, to map flow, to increase scale and efficiency?
See, India is a very interesting case in point in eye care. The whole world does roughly about 30 million cataract surgeries, of which India does close to 9 million cataract surgeries. US does about little more than 3 million. Europe does about 2.5 million, and the rest of the world, including China, Japan, all of them contribute. So India has a very significant presence. Was not how India was about 20, 25 years ago. Key challenges in those times was affordability. India with a per capita of $150, and people could not afford eye care, and they were all in the rural areas. They would not be able to access eye care. So Dr. V was working on this model, and it has been refined over decades. But even to begin with, very early, he understood that efficiency was very critical. High volume was very critical, and high quality was very critical. So he created outreach programs to reach out to people who were blind, who brought them to the base hospital to do surgery. He devised, the way you would have read about it, two operating tables. Surgeon moves between one and the other to create efficiency. But he had very little choice. Even today, there are only 30,000 ophthalmologists for 1.5 billion people. Whereas in US, for 350 million people, there are close to 45,000 ophthalmologists. So Dr. V was pioneering. His vision was to enable and give vision to people who could not have money. So there was a lot of challenge in the world in the late 80s, because the developed world had moved on to intraocular lens surgery for cataract. And India was only doing the conventional surgery, all the developing world. So Dr. V and the founding team, got into manufacturing. They made intraocular lens, sutures, pharmaceutical products. So the holy grail has been, how do we give vision to a common man? They've been constantly pursuing that, and things have changed. The country has evolved, per capita has grown. Today, India is at par with any other developed country in eye care, thanks to Dr. V and people like him in the country who have made it possible.
I see that this problem was tackled in many different issues from many different angles. And that's really one aspect of successful quality improvement, is that you don't have one intervention, but have multifaceted interventions to tackle a range of situations and issues. So clearly, Arvind not only provides excellent eye care, but it is also a financially sustainable business. So it's a non-for-profit, but it does not rely on donations or government assistance to keep it afloat. It's fully funded from fees from paying patients, and this subsidizes care for patients who cannot afford to pay for their care. And the organization is named after the spiritual leader Sri Aurobindo, and its values are guided by Aurobindo's philosophy of humans being the force that the divine works through. Arvind's model at its core relies on efficiency, and scholars have studied your system a lot, and some call it an assembly line approach. I read that Dr. V spent some time at McDonald's Hamburger University in Illinois, here in the US, and replicated some of the concepts like volume, standardization, consistency, cost control. But really, when you closely look at Arvind, it's much, much more than assembly line care. So give us some of the highlights of how your operating room maximize the efficiency using concepts such as lean management that are now used in healthcare in a range of settings. We have listeners from a variety of backgrounds, and I just want them to understand how some of this works in real life.
You were alluding to Dr. V visiting McDonald's. I think it's a very important aspect in a leader. Dr. V was this one end of the spectrum. He was a very spiritual person. And the other end of the spectrum, he was very pragmatic. He said, I need to give care. It's not the financial modeling alone or affordability alone, but I need to get to everybody. But he also realized it has to have sound management principles. what works in an assembly line in a manufacturing of a car, how do they build efficiency, how do they make it zero error. So all of that fascinated him. When people talk about high volume, people only see the number of people getting to see the world better, through surgeries. But a lot of work goes before and during surgery to make that possible. To be able to build a high volume setup, if somebody asks us what is our biggest challenge in Arvind, it's not surgery, it's the logistics. We operate every day close to 3,000 patients. We see close to 22 to 23,000 patients every day. Handling all that patients, transporting some of them from eye camps, feeding at least 1 or 2 meals every day to all these people. They don't come alone, they come with a family member. And we have to provide water. So we use about 3 million liters of water a day. We use about 2 million units of electricity a year. So all of that have to come together to be able to enable this volume. So it's not that we are efficient in the operating theater alone. So that is a given that has to be done, because that is where the magic happens. People start seeing. But a lot of things have to fall into place to be able to do that. So for a cataract surgery, our estimate is about close to 45 hands touch the patient. So all the 45 have to be synchronized to be able to give better vision, right? Somebody can make a mistake in the measurements. Somebody who is autoclaving the instruments can mess it up. Somebody who is taking care of supplies or the intraocular lens, the power can be changed. So a lot of things have to fall in place. It's a teamwork and a journey of constantly evolving systems to avoid errors. So that's what makes it possible. So it's the team that constantly strives to give the best every day.
Yeah, and you mentioned two things that really struck me among the many impressive aspects of this work. The first one is the magnitude of the outreach that you do, and the second one is the teamwork. So let's first talk about the outreach. And so Arvind Eye Care System lets eye doctors focus on diagnosis and surgery by cross-training nurses and technicians and engaging in community outreach through eye camps, mobile diagnosis centers, telemedicine, and storefront vision centers. So, this is especially relevant given that about 60% of India is rural, and these eye camps go into villages to increase access to eye care as well as cheap glasses. I still myself get sticker shock every year when I see my out of pocket cost for my glasses here in the US, despite my having good vision insurance. So, at your eye camps, patients who need surgery come in, as you mentioned, with one of their family members. They're given transportation and accommodation to come into the closest Arvind hospital for their free surgery if they are availing of the free surgery option. So tell us some more things that we need to know about this approach to outreach if someone wants to replicate this. Like, what's the secret sauce? What's a key ingredient that plays a role in successful outreach?
When hospitals open, there is a lot of compassion in most organizations. So they said, we will offer our services free, or we'll offer it at an affordable price. So a lot of times the bottleneck is not your price. The bottleneck is, how do I come to the hospital? Who will accompany me to the hospital? What is about the lost wages for my person who is accompanying? It could be a daughter, son, or a neighbor. So outreach became an integral element. And outreach enable us to build that buffer. When you're doing high volume, 3,000 surgeries means you're operating anywhere, all hospitals put together, 15 of them. Your output is about 400 surgeries per hour. So you need a kind of a buffer to feed that. Like Chennai does about 300, 350 surgeries a day. So we'll do it over 6 hours, 5 to 6 hours. We need a buffer. We need that morning at 7:30 when we start OT, we need 300 patients ready, so that the chain can work. There can't be any delay. So outreach helps in two ways. One, enables people to access, reduces the cost for that individual, economies of scale kicks in. For the organization, it creates a buffer. It enables us to build volume. Second, also the other aspect is it enables scale. So economies of scale has an advantage. We can negotiate better prices for our supplies. And the point you were making, we don't get donations because we are a cross-subsidizing model. Paying patients don't come to Arvind because we are not for profit. Paying patients come because they want to get good quality eye care. So our aspiration is to give the best care possible. So when we give best care possible to one segment of the population, it's the same care we offer to the other segment. So the market forces help us to always be on the dot, make sure that we give good care to the patients, no matter whether they pay or not. Same operating theater, same surgeon. How can you do two different surgeries?
And you mentioned that everyone gets the same high quality care regardless of their ability to pay. So, a key aspect of care at Arvind is health equity. And the same doctors and nurses take care of all patients. Surgical outcomes are the same regardless of socioeconomic status. And your system also does something very important that others can learn from. It makes the most of its employees' talents. So, eye surgeons are expensive. And as you mentioned, the amount of eye surgeons you need isn't enough to take care of the patient volume that you have. And so your system is set up to reduce surgeons' downtime and have them focus only on performing surgery. Other tasks are done by other team members qualified to do them. So your nurses are trained to prep patients for surgery and bandage surgical sites. Each of your operating rooms, you briefly mentioned earlier, has two operating tables with really fast turnaround times. So, how this works is an eye surgeon is done with cataract surgery in less than 10 minutes with the first patient and then moves on to the next operating table while the rest of the staff finishes up the care of the first patient. Then a new patient is moved into the first table and prepped by the nurse while the surgeon finishes with the second table. A surgeon in your system using this process can perform 30 to 50 cataract surgeries in a single day through this streamlined process. And Arvind's rate of surgical complications is half of that of other eye hospitals. So this sounds perfect, but I'm sure it took a lot of work to implement. So tell us, what are some of the roadblocks and challenges that Arvind Eye Care system encountered in implementing these lean principles?
See, one of the main challenges in the early days was human resource. Doctors were a constraint. We have spoken about it earlier, but the supporting personnel, what we call as allied ophthalmic personnel, in 70s India, 80s India, they were not there. So Arvind got into training these young women. We recruit them when they're 18, and then they train for 2 years. Then they work with us for about 3 to 4 years or 5 years, and then they move on, get married, and move on. The society functions in a certain way. So it was important for us to, one, maximize the bottleneck. The bottleneck in this case was ophthalmologist, and to be able to shift the tasks which someone else can do it. Someone else can do it as well, if not better, because they're repetitive tasks, and how to adapt technology into the whole stream so that the tasks are done up to the expectation of the patients and the professionals. So that was a very important ingredient. The second ingredient was, when we started, the surgeries were conventional without microscopes. And today, Arvind's surgeries are world class, in terms of output, in terms of quality, in terms of surgeons' technology that they use. Keeping pace with technology, trying to drive the technology. I think that has become a very important aspect of Arvind's work. It is not that you are a community player, you're trying to help the society, so do with what technology you have. No, no. Try to get the best technology and maximize the usage. See, healthcare is all about fixed cost. If you can increase your throughput, your per unit cost comes down. Imagine the point you were making. A surgeon operates 30 to 50 surgeries and he does twice a week. He does 300 to 400 surgeries, 300 surgeries a month. He does 3,000 surgeries a year. An average US surgeon may do about 500 surgeries. US may not be a good example because it's plenty of ophthalmologists. They are subspecialized. Even in India, the average is only 400. So imagine you have a system which takes it 8 to 10 times more. So the scale enables you to act very differently. Arvind is the largest training center for ophthalmologists in the country. And all that is possible because of the scale that we have.
And a theme of this work is keeping eye care affordable. One issue that Arvind faced about 4 decades ago was that intraocular lenses started becoming the standard treatment for cataracts. And these are clear artificial lenses that replace the eye's natural lenses that are removed during cataract surgery. But a problem then was that these intraocular lenses were manufactured outside India and were costly. So Arvind set up Orolab, your in-house manufacturing lab in India, to make these lenses, which significantly brought down the cost of surgeries. Arvind also has its own research division through which it continually looks at data to improve its care. That's a key aspect of quality improvement. Give us an example of how these efforts have changed the way cataract surgeries are performed, not just in India, but in other countries as well that have come in to learn about your model.
I think manufacturing unit set up by Arvind was fundamentally a game-changing innovation. Imagine those days when an intraocular lens was $100 and Arvind was able to manufacture at around $2 to $3. So that changed the game entirely. And today, then we were able to say for $10, we can give a cataract surgery. So that was possible because of the manufacturing. And today, Auralab exports to about 120 to 130 countries across the developing world. And Indian manufacturing ecosystem is very strong. Indian manufacturing, not only Arvind, but all the other ophthalmic manufacturers would contribute close to 50% of all eye care supplies in the world. So India has become a unique ecosystem because of the scale of work that India does, supplying to Indian practitioners as they enable them to build scale. So I think that's a very integral element that not only Arvind, but India has an impact globally on delivery of eye care. And Arvind played a very significant role in starting that journey, in spreading that responsibility we have towards the other developing countries to give vision.
The scale of your work is really magnificent. Over 700,000 eye surgeries are performed each year at Arvind, which makes it one of the largest eye care providers in the world, if not the largest eye care provider in the world. Arvind Eye Care Systems website notes that the organization has provided 85 million outpatient visits and performed more than 9.5 million surgeries since it was founded. Thinking about sustainability and keeping this work going, cultural change is important to keep a lean system like yours running well. What do you look for in the people you hire to maintain this unique culture that you have fostered over the years?
We look for a value fit. Most of our employees, the clinical employees, which who account for about 80% of our workforce, for all of them, this is the first job. So we recruit our own allied ophthalmic personnel at 18. So all of them come through that program. We don't have any lateral entry. And ophthalmologists, again, they come through our residency or fellowship. So they have all learned this culture. The only thing they know about work is only within Arvind. So one, it's easy to propagate. At one level, that enables us to continue what we are doing, keep the organization young, get the people who know they have been trained only in this system. So they don't have any other experience, to unlearn and then learn. Second is also to continue. The perpetuity will come from leadership, ensuring that we maintain the culture, we maintain the values, and we stay true to the purpose and mission of the organization. And that's not easy. The multiple generations of leadership are here in the organization. So that's the responsibility of the board, the chairman, all of us as leaders of the organization to ensure that we adapt to the change. We need to be resilient, but at the same time, always serving the purpose for which we have been founded.
So clearly, central to the core of all your work is the sense of purpose, is the sense of compassion, making eye care affordable and keeping it high quality eye care in this process. So, Dr. Arvind, those are all of the questions around eye care that I had for you. And in this show, we wrap up each conversation by learning a little bit about the place our guest is associated with. The first Arvind Eye Care Hospital was in Madurai, which is still the headquarters of Arvind Eye Care System. Madurai is located in Tamil Nadu, a state in southern India. It is one of the oldest cities in South Asia, going back to the 3rd century BCE. So tell us about a place or activity that a new visitor to Madurai should check out.
One thing Dr. V was very fascinated was the Meenakshi temple, which was built close to 1,000 years ago in Madurai. It was said that it was built over multiple generations. It started by one king and then it went on for about 150, 200 years. And it has stood the test of time. It's standing after 800, 900 years. So he always would say, don't rush through when you're building an organization. For the visitors, I would recommend them to visit this temple. The world is made like that, right? Multiple generations contribute. Things are built on the contributions made by the previous generation. People stand on the shoulders of the previous generation and build it. And that's a very important paradigm to think. And it's a very fascinating and beautiful temple. A lot of history, beautiful sculptures. It'll make your visit worthwhile.
Well said, Dr. Arvind. And so, not only an archaeological marvel, but also something to learn from the philosophy of some of these historic monuments that have stood the test of time and are enduring and can teach us lessons. So, those are all the questions I have for you. And I really thank you for taking the time from India to join me today on Mapping Healthcare. Thank you, Dr. Arvind.
Thank you, Ulfat.
So that was Dr. Arvind Srinivasan telling us about how Arvind Eye Care System uses lean tools to increase efficiency and value for its patients. There's a lot that I heard that we can learn from. The clinical team supports each other's work. People practice at the top of their license. Eye surgeons don't waste time on processes that other staff members can do, or spend time on billing, coding, or extensive documentation. Waste in the form of waiting times, non-value-added steps, and unnecessary processes is minimized. Workflow is efficient and specialized. Downtime is reduced through their unique operating room model. Surgeons and other staff are assigned specific tasks, and they do these tasks again and again till they get really good at them. This standardization and specialization means that their task eventually takes them much less time to complete and reduces variation in care and errors. And a large number of patients get much needed care, many of them for free or low cost. High volume is a key factor in this model. Arvind has fixed costs for its operating rooms and staff, whether a surgeon performs 3 or 30 surgeries a day. So increasing volume means that fixed costs are distributed among more people. And the model benefits both paying and subsidized patients. Paying patients drive up quality of care by expecting good outcomes for the money that they pay. And subsidized patients improve value for paying patients because the organization does its best to control overall costs to keep this a financially sustainable model. Mapping the patient's journey or a clinician's journey every single step from start to finish. This is how you uncover hidden waste and see the whole picture, crucially, involving frontline staff in that effort. So pulling this all together, we saw that lean management isn't some abstract theory or just for factories. And it's not just about hospital or clinic efficiency. It's a way to change healthcare, reducing waste and making things better for patients and healthcare staff. But the key takeaway is that it's not about implementing tools like value stream mapping. Success hinges on a deep cultural shift. It needs commitment from healthcare leaders, and it really needs every single employee to feel empowered to see themselves as not just doing their job, but also improving the way they work. Thinking about what we've discussed today, can you identify some hidden waste in a healthcare experience you've had recently? Maybe waiting, maybe redundant questions, maybe just confusion. How might a lean mindset that focuses on smooth flow and patient value have made that experience better? Thanks for tuning in. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM. Please connect with the show on Instagram at Mapping Healthcare to share your thoughts and ideas for future episodes or guests. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts. If you enjoyed this episode, please don't forget to subscribe and leave a review.